it's a significant spend. It's usually, anywhere between 20 and 45% of the total operating budget, and it's something that when you really dig into, when you really look at, it's very impactful from not only from a service standpoint, but obviously from a cost standpoint.
And when a hospital focuses on it for cost improvement, the opportunities are significant. VIE'S clients achieve anywhere from 25 to 35% in immediate cost reduction. Some of the biggest challenges that hospitals face when they look at their purchase services spend is that it's highly decentralized. It's across many different departments with multiple vendors, and also the ability for a hospital to get true pricing insight. I think that's the biggest issue, whether they're getting a good price, a good contract, the ability to feel confident that they've got best pricing in the marketplace.
It's usually an outsource. It's something that they're relying on for information. It's something that they're relying on for services. And even though they're a vendor, they're really considered part of the team. So sometimes it's difficult to negotiate with a friend, someone that they've been working closely with, and they might have a great service, but at the end of the day, do they know if they're getting a good price? A lot of times people prefer to have us come in and take a look at it because they're the third party. They're the ones that really are unbiased as far as the relationships. They understand. I mean, we take into account a lot and the importance of why that purchase service is so valuable to that organization. When we walk into an organization, we investigate and come back and explain to our clients where we believe the costs are, where we believe that there's opportunities for savings. I believe that some other times when other organizations come in to review purchase services, they ask what the problem is. They ask, where do you want us to look? So that's the first and foremost, because we really have a target list of where we know the opportunities exist from past experience, from where we see the market moving.
VIE'S purchase service engagements are unique in the marketplace. We have specialized subject matter experts, we have pricing insights, we have the expertise in putting together the contracts. We truly were the pioneers in purchase service spend. Long before anyone started to look in this area, we were analyzing that spend, we were achieving cost reductions.
Sometimes the invoices don't really explain what the service is and what the fee is and how do they get to those costs. So really the first step is always to understand what the terms and conditions are with the rate, and then map that back to the actual cost, the actual invoices, and what they're being paid. Because that's really the groundwork, that's the foundation to determining what it is.
Run a 12-month AP vendor spend report and look at your purchase services spend and categorize them. And then sit down with your departments and get an understanding of their needs and those opportunities that may exist. And be open-minded to how you construct a new purchase services contract. There are many different ways that you can put safety nets in place, whether capitating an agreement or measures in place to make sure that those savings that were promised are actually achieved. When we started the company, we began looking at purchase services when no one else was looking at that spend category. We looked at non-PO spend and rolled up our sleeves, copied invoices, looked at contracts, and really became an expert in that field because we were looking where no one else was looking. We didn't just take a data dump or a PO dump and look at that spend category when we began our initiatives. We looked at everything. So we've amassed a long history and data and insight because from the beginning we've always rolled up our sleeves, pulled invoices, matched them to agreements. So I think that history has made us very unique in the marketplace and very successful.